Good morning, everyone. As you start to come in, we'll get started in a couple minutes, 2 or 3 minutes here. So you are muted and you're off camera, so automatically. Hello, everyone. We're going to just give it about 1 more minute. Okay, well, we're going to go ahead and get started. Welcome everyone to this Q&A. This is kind of a little different for us. I have with me, my name is Holly, and I have with me today Mel Reimer, and so we don't have a slide deck or anything. This truly is just a Q&A for you guys to ask any questions that you might have regarding ACA reporting. So we have a few questions that were previously sent to us, so we have some to start out with. But if you have a question that you just want to get started and to ask, we at the bottom of your screen, you should have a few icons there, and one of them is a little box that says Q&A with a question mark and a comment box. If you open up that box, you can type in your question there, and that's where we can read those and answer those from. So with that, I'll just do a little introduction. As I said, my name is Holly. I've been with HR Service. Actually, yesterday was my 10-year anniversary, and or 2 days ago, yes. Anyway, and I have been doing ACA since I started. So just a little background. It's the patient. Now, I always forget this, PPACA. So the Affordable Care Act, it was enacted it became law in 2010. And then the government spent a lot of time like getting things put together. lots of comment sections. DHS, Department of Health Services was part of it. The IRS was part of it. Department of Labor, CMS. There was a whole bunch of organizations, governmental organizations involved in this. And I remember I was working in HR at the time, and I thought, I don't think I want anything to do with this. It sounds way too complicated. And then lo and behold, I get a job at HR Service. I was low man on the totem pole at the time, and they said, "Hey, we want you to lead this service for ACA reporting." So I have been involved in that ever since. We started reporting. Was started for 2015, so it was in 2016, and we've been doing reporting ever since. The first year was by hand. It was me and one other person, and we had about 50 clients, and now we have a team of about 20 ACA specialists, and we have over 500 clients that we do ACA reporting for. So, and with that, I'm going to introduce you to, or have Mel introduce herself. She's been with us for going on 5 years. Mel?
Oh, thank you, Holly. Yes, so I'm Mel. I'm our compliance services supervisor here at HR Service. I started on the ACA team and have loved being involved and watching it grow. So, yeah, we're excited to be here to answer your questions today.
Yeah, so I don't see any questions that have popped up yet. So I'm just going to get started with the questions that were sent to us. So if I'm looking over to the side, that's just I'm reading those questions. So the first question that came through was, what's the deadline for ACA filing this year, and did anything change? So the easy part to that question is the deadlines. So, and those kind of have remained fairly consistent over the years. So the e-filing is due by March 31st, 2026, unless you request a 30-day extension, which you can do online through the IRS's FIRE system. And and it's an 8809 form. So as long as you file that before the due date, you can extend that due date by 30 days. Then there is then there is the getting the forms to employees. So that used to be January 31st, but it always got extended. And then it just consistently became the end of February, beginning of March. So that is next year, technically March 2nd, 2026. However, last year, it kind of came in right at the end of the year, but it was backdated. And so it didn't get a lot of attention because everybody was sort of already in the middle of all things ACA reporting. But the Congress enacted a new law where if an employer can post in a conspicuous place where an employee can get a copy of their 1095-C form, along with the contact information, who to ask, where to ask. As long as that's posted and an employee asks for a copy of the forms, the employer has 30 days to get those forms to them. So if that's the way you want to go, then that posting needs to be posted by March 2nd. Now there are a lot of states that require reporting as well, and so I'm just going to take a little. I have to look at my notes here. So California requires it still requires employee distribution. So keep that in mind. That is actually due February 2nd because January 31st is a weekend day. So that is due February 2nd. Then there's three other states that we help with the reporting for, and that's Washington, D.C., New Jersey, and Rhode Island. And those are due to employees March 2nd. And but the e-filing for those are due for the most part, the same as federal, which is March 31st. Now, there is a question about Massachusetts. They also have some due dates. That is not a state that we are able to assist with. That is something that you have to go directly to the Massachusetts state website to file for those. As far as any other changes other than that law that I mentioned, just the normal updates. There's always the update to affordability percentage, to the federal poverty level, to the penalty amounts, which we'll touch on in just a little bit.
All right, thanks, Holly. The next question that we received was, which form do you need to file? 1095B forms, 1095C, or both? For the 1095C forms, these are used for employers that are considered an applicable large employer, an ALE. So they need to have 50 or more full-time or full-time equivalent employees. Now, your 1095B forms, these are used for health insurance providers or for smaller employers. Excuse me. So the non-ALEs. And it's rare that you need to ever file a 1095C and a B form, but so in short, if you're a large employer, 50 or more full-time equivalent, you need those 1095Cs. If you're small and self-insured, you need the 1095B forms.
And just one other thing, the 1095B forms, that employee distribution uh, part of that, that actually changed a couple of years ago. So
Hmm.
the 1095C forms just caught up to what the 1095B forms were already required to do for employee distribution. So um, and I want to mention part of the reason that happened is because there wasn't an individual mandate when the law was first rolled out, and then a couple years later, there was a court in Texas that found that the individual mandate was not legal. And so that's still kind of in the court system, like being vetted out. So the individual mandate hasn't officially like gone away, but the penalty to the employees is zero. And so the 1090/40 form change, that question is no longer there. So that's part of the reason why getting these forms to the employees, I think, is not quite as critical as it once was, is because they don't need it for their taxes anymore. And technically they never really, they needed it, they didn't need to send it in. So just FYI. The next question that came in is do I still need to offer affordable coverage? And how is affordability calculated now? So the answer to that is yes. Employers still are required to offer affordable coverage, and that actually gets updated every year. So if you don't offer affordable coverage and you and some and an employee goes on the marketplace and they get a premium tax credit, then you could be subject to called the 4980 HB penalty. And so that's still in play. For 2025, the percentage used for affordability was 9.02%. And in 2026, it's 9.96%. And one thing I see that employers are getting better at this, but there's three safe harbor affordability safe harbors. One is if it's below federal poverty level. So if the premium to the employee for 2025 is less than $113.20 a month, then you're good. If in 2026, if it's less than 129.89 a month, then you're fine. There's also the rate of pay affordability and the W-2 affordability. The rate of pay affordability, the calculation on the IRS's website is 130 hours multiplied by the lowest rate of pay that the employee had during that calendar year, multiplied by the 9.02% or the 9.96%, whatever that percentage is for the year. And that's how you come up, divided by 12. And that's how you come up with how much it can be per month. And a lot of times I've seen employers that they're thinking, oh, I can do 160 hours because that's what a full-time person tends to work. But it is only 130 hours because the IRS redefined, or the ACA redefined, what a full-time employee is and the number of hours they worked. Um,
Hey, Holly.
yeah,
Oops, sorry. I do see we have a question here.
okay.
And I believe it's your favorite topic. How do we report when employees receive cash instead of receiving health benefits? So I think
Um,
they're referring to ICRA.
Well, that could be ICRA, so it could be a lot of different things. So um, there are different ways. So it depends, first of all, if you're an applicable large employer. If you're a small employer, it's not a big deal because you're not held to the same requirements that an ALE is. So if you receive cash, um, it kind of depends on what that cash can go towards. So there was a law put into place about 5 years ago where you could have an integrated it's ICRA, an HRA plan. And uh and so that one is, if you it's you have to go look at the silver plan costs for that employee from either where they live, so their zip code from where they live or where the company had, the location of the employer, and then you have to look by their age. And so the amount that you give them has to be enough to meet the cost of that particular premium on the marketplace, or otherwise it's not considered affordable. There's also so that's if you are offering that has an HRA. If you just do cash, it's sometimes, are you doing everybody gets the same amount? Um, and then is it covered under ERISA? Is it a 125? So it's not like an easy answer. And I see, if you want to email us, I can give you a little more information, because sometimes you actually have to add that amount, or maybe it's not even considered a qualified plan under the ACA. So I would say most of the time, unless you're doing ICRA, an integrated plan, then then it won't meet all the requirements under the ACA.
Great. We do have a question from Scott, some clarification on the affordability threshold. If the monthly premium for employees is $129.89, it's automatically considered affordable. That would be correct for 2026. For 2025, that FPL threshold is 113.20. So if it's at that amount or lower, it's considered affordable using the FPL safe harbor code. All right. So our next question that we received, what counts as a minimum essential coverage and minimum value? So minimum essential coverage, or MAC plans, essentially, those are employer-sponsored plans, government-sponsored plans like Medicare and Medicaid. If they provide MAC, the covered individual got basic coverage required under ACA coverage rules. So that would be preventative care, doctor services, hospital care, and prescription drugs. Now, minimum value, this means that the plan must pay at least 60% of the allowed cost of benefits. and provide substantial coverage of inpatient, hospital, and physician services. Now, if you offer a plan that's has minimum value, um, provides MEC, and is affordable, then that's great. That means you are meeting your employer obligation under ACA rules. If you're only meeting MEC, that doesn't cover that obligation, and you could be subjected to penalties.
Um, So the next question, I don't see another one that's come through. So the next question we had sent was, how do I handle reporting for part-time, seasonal, or variable hour employees? Um, so the first thing is those particular classes of employees are treated a little bit differently when you're determining if you're an applicable large employer. So, calculating the hours. But if you have determined that you are in fact an ALE or an aggregated ALE, then it comes down to creating a measurement period. And then it's a measurement period, administrative period, and a stability period. So, and you want to do that before, and you want to have that already set, maybe put in a file of how you're doing that. So there's the initial measurement period, and that's when a variable hour or seasonal or a part-time employee is first hired. And so you can put them into the rules say it can be 3 months to 12 months. But the stability period, which is the period that they have to be on insurance, has to equal the measurement period, but cannot be less than 6 months. So we always suggest at least have it be 6 months, because you'd have to keep them on an insurance plan for that long at minimum. So what I see is initial, I usually see that 6 to 12 months with a 1 month administrative, and that administrative period can be up to 90 days, but for a new hire, you can't go longer than 13 months past their hire date. So, and then you put them on the insurance and they stay on that insurance for 12 months. Then you have an ongoing measurement period, and that runs concurrently with the initial measurement period. So as you're running them in that initial, you are also running this ongoing, and the ongoing tends to be the same look back measurement period all the time. So most employers, what they do is they run that along their plan year or part of their plan year. And then they give themselves, 30, 60, even 90 days administrative time where they can calculate the hours and determine which employees, based on working 130 hours a month on average, during that measurement period, need to be offered insurance. So it can get a little complicated, and we can provide like examples of something on how that would look like if you are interested in that. But if they are determined, these employee classes, to have worked full-time hours, then they do need to have an offer, and they do need to be reported on whether they decline or sign up for the insurance.
All right, thank you. Our next question that we got, what if an employee declines coverage? Do I still need to report them? So if you're an ALE, so you're filing that 1095-C form, then yes, each full-time or full-time equivalent employee, regardless if they declined or waived or enrolled, needs to have a form. If you are a self-funded non-ALE, so you're filing those 1095-B forms, then you only need to report the employees who enrolled.
So let's see. The next question I have here. Okay, how do I track and report a break in service? So the ACA rules allow for if an employee has less than a 13-week break in service and they have already met their administrative waiting period, then benefits need to be offered by the very next first of the month. So there should not be another waiting period put in place. If they go beyond the 13 weeks, or if they didn't meet the waiting period, then they can be put into another waiting period. So, for example, somebody's hired in February and they have a waiting period of 30 days. So their benefits would have been active on April 1st, and they end up terminating April 30th. So because they've already met that waiting period and they're hired in, and say they're hired in June, they need to have their benefits offered to them by July 1st because they already met that waiting period. If they aren't hired like till October, then they can go back into that waiting period. So that's kind of how that works. And if they don't meet the waiting period, they were hired in February, they were termed in March, and then they were hired in June, they go back into another waiting period because they never met it in the first place.
Our next question, what are the penalties for incorrect or late ACA filings? All right, so late filings, it's $60 per form. And then after 30 days, but before August 1st, it shoots up to $130 per form. After August 1st, it shoots up again to $330 a form. Then after that, it's considered intentional disregard and it goes up to $660 per form. Then there's the pay-to-play penalties. So these are the 4980H A and B penalties. That A penalty is when an employer doesn't offer coverage to at least 95%. And your B penalties are for plans with no MV or they're unaffordable. So in 2025, that A penalty for, again, not offering insurance is $2,900 per year per full-time employee. And then $4,350 per year for was that the B penalty?
Yes.
Yeah.
Yeah.
So they get up there.
I will say, after doing this for so long, there's several different kinds of letters that employers will get. And when we were first starting this, we were trying to be so careful in what safe harbor code we would use and making sure that it was affordable, thinking that the IRS would pay attention to those safe harbor codes. And what we have found over the years is how these penalties tend to be triggered or flagged for the IRS is when employees receive a premium tax credit. So they will, uh, yeah. So, and even if you've done the forms completely correct, they'll still question whether or not it was affordable because that employee has gone on the marketplace and they received some kind of subsidy. And so it's really a matter of saying, yeah, we did everything we were supposed to do, and here's the calculation. And I find with at least our clients that we help with those letters, 99% of them, walk away without having to pay any kind of penalty. So anyway, that's just kind of a little side note. Um, the next question that came through is, how do I report COBRA or post-employment coverage? So that one, the only time we really see that is with, first of all, with self-funded plans. It doesn't apply for fully funded plans. And so self-funded plans, whether it's a C form or would be on a B form, when we might do those is if they were not an employee the entire year. If they were an employee for part of the year, the coding would reflect that on the 1095-C, but then in the part three of the 1095-C, you would show the months that the employee and their dependents actually had coverage. If they were not an employee all year long, they don't need that 1095-C. What they would need is just the 1095-B form, and that would just show them, what months that they were covered. And that's really more for their records than anything else. So,
All right. Um, our next question. Can I correct a filing if I've already submitted it to the IRS? Yes, absolutely. You can make corrections. It does depend on how it was filed and what vendors were used. But yes, you can definitely make those corrections if you needed to, if you accidentally put in a wrong social security number or address changed or someone got married and their name changed. Yes, those can be corrected.
it does get, I have noticed, so the IRS's system that they used for their e-filing is called the AIR system. It's AIR. And it's not the same as like the systems that they have for us to file like our regular taxes. And so there's only a few vendors, I would say, that actually have that do it. And so we partner with a company that we've been using the whole time for e-filing, and and so we can look up if somebody has filed a form, if we filed it on this particular system, but the IRS right now does not have a mechanism for us to go in and look to see if a form was filed, or an employer would not be able to go look and see if forms were actually filed for for a particular year unless they knew who they used to file those forms. So that is kind of a downside when trying to check to see. April had a quick question, and will we be sending out a Q&A sheet? Yes, we'll send out a Q&A sheet for everyone on the webinar today, and we also have a recording that we'll be sending out as well. So good question. I don't have any other questions. Does anybody else have? Oh, I do see a couple of other questions.
Nice.
Um, you got it, Mel?
I can read it off first.
Okay.
We are an employer in California with fewer than 50 employees. Do we still need to report anything? We provide health coverage and cash for some employees. Also, if we go over 50 employees over the next year, do we need to change the cash option benefit?
Okay, so if you are a small employer and you are self-funded in California, you do need to report that both federally and in California. Um, so there is that part of it, and but there's no so as far as your cat providing cash, that really doesn't come into play if you are considered a small employer because you're not held by the same rules. However, part of determining if you go over 50, that's a really good question because it's not we went over 50, by the end of the year. It's actually you take you measure the whole calendar year. You count the full-time employees plus you count hours of the part-time employees or variable hour employees, and sometimes seasonal, but that's where some exceptions come into play. And then you average those out to determine for the whole calendar year, did you average more than 50? And if that's the case, then I would definitely talk to your broker about looking at some alternatives other than offering cash in lieu of benefit options, so that you meet all the ACA requirements.
All right, our last question we have as of right now. If an employee, oh, a little coding story for us. If an employee is terminated any day after the first of the month, are they offered coverage the whole month? Contingent on the termination benefit date and rehired within 13 weeks. How is this reflected in the coding? So they were termed 4/4/24, rehired 5/5/24, benefits offered first of the month after 30, and benefits termed end of the month.
Do you want me to answer?
Oh, yeah, sorry.
Um,
Just,
okay, so if they term, so when was their, I don't know where their original hire date was, so that kind of will make a difference. So
yeah.
say they had benefits up until their term date, whatever. So, and then their rehire date, how that would be coded. So assuming that they had that for all year. So it would be whatever the code is. Most of the time it's a 1E. That means you've offered in line 14, and that means that you've offered what you were supposed to offer to everyone, including the employee, the spouse, and the dependent. So 1E would be for January, February, March, and April. And then it'd be the amount in line 15. And then it would be, say they accepted benefits 2C through April, contingent on when the plan document says that benefits end. So if it ends the end of a month that they terminate in, that it would be a 2C for all of April. Then in May, when they were rehired, because they were rehired with obviously within that 13 weeks, um, because the IRS does not let you count sort of partial months, the coding on line 14 for May would be a 1H, and then in line 16 would be a 2D. You just got to throw them in because it's just a partial month. And then it would be back to in June a 1E with if they took the insurance, then it'd be a 2C for June in line 16. I hope that was helpful. But we love coding questions.
Yes. All day, every day. Uh, so if you have any more questions, go on and drop them in there for us. We're ready for it.
We do have a few tools on our website. Just want to mention those. We do have a ALE calculator that you can, if you go on our website and look under ACA, I think it does require you to put in some basic information so it can get emailed to you. But there is a calculator, and within that calculator, it gives the rules about seasonal employees. So you can take a look at that. That is also a service that we offer where we will calculate the hours for you. And really what we need is just the payroll hours for the employees that worked in the year that we're analyzing. And then we can determine two things. First of all, are you an ALE? And then if you are, we can look to see which employees need to be or should have been offered coverage. We also offer service. We do full service ACA reporting. We also do that. We do trainings. So we've worked with brokers to do trainings for their clients, both on C forms and for B forms. And we're always happy to do that. What else? What else do we? Oh,
Tax
we
filings, IRS letters.
yeah, past filings. We respond to IRS letters, whether or not you've gone with us or not. We so there is a fee if you are not a client of ours, and we help respond to an IRS J226 letter or L226 letter, which is the 4980H penalties. And the 5699 is also a popular letter. And that is a letter from the IRS that says, we think you were an ALE and you should have filed and blah, blah, blah. And so it gives you an opportunity on the second page to say, no, we weren't an ALE and here's why. And they're going to require you to show why you are arguing that you weren't an ALE. Or you can say, oh, no, we were and we filed. Or you can say, oh, oops. Yeah, I guess we were and we'll file and they give you up to 90 days from the letter to file. And so we will help file those past year filings for you. So we do have that ability to go back. There's the law that was passed last year, they did put a statute of limitations. So it's 6 years now, and so we can go back to I think it's still 2019. That may be updated. We're kind of at the mercy of the system that we use. So I think that's going to be updated next year to 2020, but we can go back that far.
Oh, we do have one more.
Okay.
My company teeters between 48 to 53 full-time employees throughout the year. How should this be handled? Is it based on how many employees you have by a certain date, or is it if you hit 50 full-time employees at any time during the year?
So it's really just the average for the entire year. So say you go 50 for 5 months of the year, but then you're 48 um, employees for 7 months of the year, chances are you are not going to be considered an ALE. But but yeah, you really have to add those and average them out for the entire 12 months, the prior 12 months.
So to be able to file for 2025, you would have to be full-time for 2024. So, right.
Yeah. So this year, if you just add all your full-time employees, if you have part-time employees too, though, you do have to add their hours. And again, this is why having that calculator is helpful because you don't have to add any more than 120 hours and then you divide by 120 hours. So the IRS is just there's just kind of weird calculations that they've put out there. And, I don't know how they expected everyone to know all about this, which is thankfully why there's companies like ours that help companies like yours do this reporting because it's not always super straightforward.
Okay. I'm not seeing any more questions.
Okay, well, we had 45 minutes, so we're almost to the end anyway. Just we didn't know what to expect, so uh, usually you have like a deck to sort of rely on. But we will, like I said, we'll put together a little FAQ. We will send you the recording, and just want to thank you for your time today. And if you have any questions or you need assistance, just reach out to us. We would be happy to help. Like I said, we've been doing this since it started, and we've got a really, really great ACA team that can help out.
All right. Thank you for joining us.